is starting this week in Arizona, and sometimes the options can be a bit confusing.
We're looking at how to compare all the plans so you can decide what works best for you and your family as well. April, good morning.
Good morning. We're counting down to Halloween. You may want to watch this trick-or-treat forecast, though. We'll tell you if you need to dress in layers. It's 6:39.
All right, thanks, April. But first, that balloon boy hoax that captivated the nation was 10 years ago.
Well, the 6-year-old boy who was reported trapped in a helium balloon flying over Colorado is now a teenager. Here's Balloon Boy talking to ABC's TJ Holmes in this morning's GMA First Look.
Hey, happy Tuesday to you now at 6:44. So by now you may be deep in health insurance terms as you decide which plan is best for you and your family.
Well, this morning, Joe lets you know how some Arizonans can actually get free coverage and the differences in plans you may be offered right now.
Most Arizonans with health insurance get it through their employers, 45% according to recent stats. And many plans come with a big decision. Go with a PPO, Preferred Provider Organization, or HMO, Health Maintenance Organization.
A good way to put it, Joe, is that choice is expensive. The fewer choices you have, the less you pay.
Alan Jursvik is a healthcare navigator with Arizona Alliance for Community Health Centers and says don't pick plans based only on the premium, how much you pay for coverage each month.
If you have a really low premium, you're going to pay more when you see a doctor or when you have a medical need.
Jursvik says you must compare deductibles, how much you pay before insurance pays a percentage, copays, what you pay for each service, and the out-of-pocket max, what you pay before insurance pays at 100%. HMOs will likely cost less. While you have copays, premiums are lower with low or no deductible. But for that, you get fewer doctor choices and
you have to see your primary care doctor before you can see a specialist.
And anything out of network is only covered if it's an emergency. If you don't have an HMO option, you likely have several PPO plans. Same comparisons apply.
In a PPO, you can choose from more doctors and hospitals normally. They're generally more expensive, and in most cases, you can go see a specialist without seeing a primary care doctor.
PPOs are more flexible. You can use in-network or out-of-network docs, but they're more costly. There are multiple deductibles to meet, out-of-pocket limits can be high, premiums cost more. Compare deductibles. The lower they are, the higher premiums usually cost.
Jursvik says if you have an employer plan option, it's your most cost-efficient because employers pay part of the costs. Go to kgun9.com for links to all this information. I'm investigator Joe Ducey. If you got a problem, let me know.
First warning weather with meteorologist April Madison. Brought to you by Tucson Appliance and Furniture Company.
6:47.